Power 93.7 WBLK. I'm Yasmin Young. This is the 2 to 6 takeover. As we are settling into this new normal and we don't know when exactly it's going to end, I know a lot of folks are stressed. I know a lot of folks may be dealing with some mental health issues just because of all of the challenges that are now in front of us, and they probably weren't in front of you maybe a week or so ago. So I have the pleasure of having Karl Shallowhorn, who is the Education Program Coordinator for the Community Health Center of Buffalo, on the line with me. Welcome, Karl.
Hello, Yasmin. How you doing?
I am as good as we can be in these times. I know that, people have been socially distancing. They've been isolating themselves. And it starts to get to, we're social creatures. It starts to get to us, the stress of maybe not having a job, maybe losing a job. The uncertainty of it all kind of can stress people out a lot. So as we deal with these uncertain times, what can they do to deal with this?
Well, first and foremost, I always tell people just to breathe. Breathe. So, believe it or not, deep breathing can really help someone in terms of reducing stress and anxiety. And when we breathe, we kind of give ourselves an opportunity just to, rejuvenate ourselves. And also, we reduce our anxiety by reducing our risk. So we've been hearing a lot about practicing good hygiene and so forth like that. Those are things that are really important to do, because if we know we're being proactive and doing those things, it's going to help us to understand that they work and they're going to be able to help us get through all this. There's a lot of other things you can do, like manage the amount of information you take in. Like, we're getting all bombarded with all these stories and 24-hour news and breaking news. Set limits, right? Step away from the TV, get off the social media for a little bit, and that can help too. So I really encourage people to kind of set those boundaries as well.
And you kind of touched on it, but, a lot of people may be experiencing anxiety, or maybe their teen or their children are. How can they ease some of that?
Well, certainly there's a lot of ways you can deal with your anxiety. A lot of it's through self-care. And, like I mentioned, breathing, things that you can do for yourself, like exercise. Now, I know not everybody can get out and exercise, but there's still things you can do to stay healthy. So whether go for a walk or just even get fresh air, like step outside, get some fresh air. You can also practice, things like eating better. Certainly staying away from drugs and alcohol is a big one. I would also encourage people to do things like just stay in touch with other folks. Just try to stay in touch with people, find someone to talk to, and also to listen to. We need each other through these times. And also, don't forget about your faith community. There's a lot of people here, that myself included, who are learning new ways to worship. Just yesterday, we worshiped on Zoom. So there's a lot of things people can do to stay connected with each other despite this social distancing we're going through.
And I know you said stay away from drugs and alcohol, but I swear to you, everybody on social media has a bottle, at least one bottle of an alcoholic beverage. So my question is, how do we steer clear of it when we are stressed out, when we're trying to figure out what's going on, what's going to happen in the future, and that becomes a coping mechanism, drugs and alcohol?
Right. Now, this is one that we have to be really careful of. And I'm not telling people to become, as the old saying goes, teetotalers or not have a drink, but you have to set those limits and recognize that if you are, using more than used to, there's things you could develop a tolerance. Addiction can occur at any age. So we have to be really careful about how much we're using. Set those limits. Just because, you're home all day doesn't mean that you can hit the bottle all day. And also just remember, too, that, if you have children at home, they're going to be watching your behaviors and seeing you do more, and that might encourage them at some point to engage in those behaviors. So we have to model also for our kids, what these healthy behaviors are.
Okay, so you've given a lot of great tips. Just to recap, give a few of the tips that people can just keep with them to deal with all of the stress, anxiety, uncertainty that they may be experiencing right now.
Well, certainly, like I said, monitor your anxiety, for one thing. Anxiety is a typical thing that we all go through, but sometimes it can interfere with our lives. We might have trouble sleeping. We might have trouble, concentrating. We might be angry. I'm sure a lot of people are angry or irritable. So monitor that. If you're feeling that, then use some of those practices, like I said, breathing, meditation, prayer. Even those things can help. So we know those things are helpful. Also, there's a lot of really good resources in the area if you feel yourself really being overwhelmed. In other words, if you need that extra bit of help, most of these programs in the area, the counseling services, including CHCB here where I work, are offering telehealth or some type of services. So our program here is our behavioral health program, and the number is 986-9199 if you need to make an appointment with one of our counselors. Also, Best Health, Behavioral Health, Horizon Health Services, Spectrum Human Services, Endeavor, they're all offering telehealth services. And lastly, if you really are very in a critical space where you really feel in danger of taking your life, if it gets to that point, crisis services is there. If you really feel like you need to reach out and talk to someone, crisis services can help. Their number is 834-3131. The number again is 834-3131.
Karl, I thank you so very much for just giving us some tools to cope in these uncertain times. I appreciate the time, and you can actually get more of these details on our website, WBLK.com. Karl Shallowhorn, thank you.
Thank you, Yasmin.